Tonight on Recruits.
2, 3, push.
A baptism of fire for a new rookie.
You're so busy worrying about what the hell am I going to do next with this person.
Keep going, keep going.
Jenna's job goes from bad to worse.
What are we going to find when we get there? Ambulance!
Wake up for me, buddy.
And Raina faces a real-life tragedy.
I was thinking to myself, is this the real deal?
This universal feeling called life.
Inner city Sydney. A month out of college, the trainee paramedics get familiar with their unusual workplace.
Do you know this job?
It's a great job, hey?
Is it really bad?
Yeah.
Oh, babe, I couldn't do it. Bloody blood, bloody guts. I don't know, people killing themselves on shit.
You'll be out all night, particularly on a Friday, Saturday night. You're going to get a lot of drunk people, a lot of mental health and a lot of drug problems.
Hi, it's the ambulance. How much have you had to drink tonight?
We got an intoxicated patient. Surprise, surprise on a Saturday night.
Whatever you do not let her vomit in my ambulance, okay?
70 kilometres away, it's a very different scene.
This is Evan, he's a probie. I'm just giving him a bit of a run through, showing him where everything is and how it all works.
City boy Evan starts his first shift in Richmond on the rural fringes of Sydney.
Yes, I've got the door.
He's familiarising himself with the new job and which ambulance he's in.
No, we're in the other one. Oh, right. That's embarrassing. Don't worry, it's easy enough done. They all look alike. I've been in IT for 8 years and I hated being stuck in this. I tried to find IT roles in obscure places, which included things like oil refineries and other slightly more unusual IT locations, but even that wasn't enough, so I feel much more inclined toward an outdoor role like this. This is one of the main roads we use. Yep.
Mentor Craig has 9 years on-road experience as a paramedic.
Something Evan needs to get used to is on the rural roads there's not much room for forgiveness, so here you run off the road and it's hard to get it back sometimes.
Craig has attended over 300 motor vehicle accidents. Evan is about to experience his first.
Car into a pole, one male still vehicle.
A female passenger has already been rushed to hospital, while her 25-year-old boyfriend, Guy, remains trapped in the car. His exact injuries aren't yet known.
So we'll be going to work on the guy still in the car, I assume. Yeah, there's another 2 cars on the scene. I'm a fair way down the food chain. What am I doing? Whatever you tell me.
The car is wrapped around an electricity pole.
From what you can sort of make up of the scene, it looks like he's come through an intersection trying to make a left-hand turn, basically lost traction and hit the pole side on.
Fire brigade, police and 2 other paramedic teams are already on the scene.
There was so much already going on when we got there. I mean, I was a bit bewildered to who to speak to.
Evan, just see Peter first.
Okay. Craig pointed me toward Peter, who was the supervisor who was managing this particular incident.
Get your probie around the other side to give Eric a hand.
Yep. When someone's trapped, it's all hands on deck. Everyone's got different jobs to do.
G'day. Peter sent me around to give you a hand if you need it.
You go around and get me an undancer try.
I sure can.
Paramedics are concerned if Guy vomits, it may block his airway, causing further trauma.
Hi, how are you?
Evan is asked to get the drug on Dancitron, used to suppress vomiting.
Got asked to draw up a drug, and I've never drawn up a drug, so fumbling around trying to get that done without cocking it up and making it look like I had no idea what I was doing. There was definitely pressure there.
Anytime, as long as it fits.
No worries.
What you're going to do, you're going to slide you to the left, and then you're going to go up on a board.
Guy is stable, but extracting him from the wreck brings its own risks.
When someone's been trapped for any period of time, it reduces blood flow. So you have issues where it can cause enzymes to come in and basically cause the heart to stop. So you can have someone that's completely stable and then you remove that force and very rapidly they deteriorate and even die.
It takes a team of 12 to carefully extricate him.
Yeah. Ready?
Go push again. 1, 2, 3, push.
Straighten your legs out, mate.
They always say it's controlled chaos, and that's very much what it felt like. you're so busy, certainly at my stage anyway, worrying about what the hell you do next. You're not too worried about the person's injuries in terms of your reaction to them. You're worried about the person's injuries in terms of what the hell am I going to do next with this person.
On every job, the trainee paramedics learn something new.
It's a good one for Evan to throw his arms into. Getting on the scene, once it's sort of already happened, you have to find your feet.
Bars up. You caught up, get bars up.
Everything is a lot faster out here in the real world. So, yeah, still kind of trying to get my head around what just happened and what I did well and what I could have done better.
The driver, Guy, suffered cracked ribs, chest injuries, a fractured skull and a brain bleed. But it could have been far worse.
See that intrusion there? Like, that's where his chest was. Look at the steering wheel's bent over, it's all gone. A lot of people have hit a pole at the same angle he's had and died instantly. So, I mean, he still could have some life-threatening injuries, but at the moment he looks quite stable and he's just very lucky.
Back at Paramedic College. After midterm exams, the students are about to get their first taste as frontline paramedics. They're spending 3 days observing on the road.
But please, your main job is to observe, but if they want you to, and I know it happens, get involved, but make sure you're comfortable with what you're doing. And it's the time for you to have a bit of fun out there.
I'm psyched. This is the next step, isn't it? We're all going out on road.
24-year-old Rainer has emerged as the class clown.
You've got to have a laugh. It just makes your day easier. It really does. It keeps me going.
But how will a class clown cope with one of the most confronting jobs imaginable?
I'm not sure how he'll handle the coalface in reality, because, you know, you're dealing with some pretty horrific injuries and that sort of thing. But I think everybody faces those issues.
Yeah, the major trauma, you know, all that sort of life-threatening stuff. So that's going to be the real challenge to deal with that sort of thing, yeah.
Rainer is stationed in inner-city Sydney. His mentors are Nathan Cito and Paul Ayres.
It's a great opportunity for Rainer to see what actually happens out on road. Some probationers, they come for their ride-along, they see what happens and it's just not for them. And it's a job that's not for everybody.
Now, his very first job. It's one that even seasoned paramedics find confronting. A young man has tried to hang himself.
It came up as like psych/suicide, but I sort of didn't really know what that was about, and then we were like, okay, we're on our way. Patient is located in the garage. Messages kept coming through, so we sort of kept getting updates on the way. Patient is still unconscious. I sort of turned around looking at my partners like, oh, you know, is this the real deal? Patient is pale.
We've got a patient with a mental health issue, so it's possible attempted hanging. So we just need to go in there and make sure we've got a decent airway and see how they go from there. Hi, how you doing? Over here?
There's going to be stuff out there that's not going to be nice. And I don't know how I'm going to react when I see it, to be honest. So that's my one big fear, getting out there and seeing the major trauma and not being able to cope with it.
The young man was found hanging in the garage by his former girlfriend and her family.
I walk in, I see this guy on the ground, and he's dying if we're not going to do anything about it soon. So it was pretty serious pretty quick.
Matey, come on. Wake up for me, buddy. Hey, matey, wake up for me, mate. Wake up. Matey, come on. Wake up for me, buddy.
Rainer is attending his very first job as a student paramedic.
Like, you open your eyes for me.
A young man has tried to hang himself.
Is this where he lives in here? No. So he's not a family member, he's a friend?
My boyfriend, ex-boyfriend.
OK. You're released.
His former girlfriend and family are in shock after discovering the man in their garage.
Has he had any family problems, relationship, work problems?
Yeah, I think so.
He's had those.
The family cut him down before calling 000. It's unclear how long he was starved of oxygen, but their quick action may have saved his life.
We've got a 20-year-old male who's unconscious at the moment, so we're just giving him some oxygen and we're going to get him out into the hospital as quick as possible.
In critical condition, intensive care paramedics have been called in.
We're getting good rise and fall on the chest.
Yeah, he starts originally 90, comes at 99.
The biggest challenge is clearing his airway and getting oxygen into his bloodstream.
What's his airway like?
He's got trismus.
Already, there are disturbing signs of possible brain damage.
At the moment, this guy's hands are starting to twist and turn, which is called decerebrate. It generally indicates that the patient can be hypoxic, which is starvation of oxygen to the brain.
One of the things asked by me is, oh, you can put the foot strap on, and I'm thinking, oh, of course I can do this. I mean...
Remember? Okay, so wrap it around.
This is one of the more basic things of ambulance practice, but putting it into an emergency situation when you've got all this happening around you, especially for me, seeing it for the first time, I found it very difficult.
1, 2, 3.
The man struggles with an obstructed airway. Bagging will assist his breathing until he reaches hospital.
1, 2, 3.
Rainer is assigned this critical job.
You come around here?
To complicate his condition, the man is bleeding from the mouth.
He's got quite a bit of blood coming out of his mouth.
You can just keep trying to suction as well at the same time. I know it's difficult.
It's all right, mate.
The man's jaw has also locked from a condition called trismus.
Aggressive bagging, if you wouldn't mind. Yeah, good seal. Nice aggressive bagging.
This made it so hard because his teeth were clenched, so we couldn't really get an airway, a proper airway. I'm bagging and the blood's sort of coming back up, so that made it very difficult.
He's quite ill at the moment. His level of consciousness is still minimal.
Has he got 2?
Yes, thank you.
Suction clear, arms clear. Yeah, go when you're ready, mate. On the floor, maybe.
5 days ago, I'm doing an exam, and today, you know, I guess I'm keeping this guy alive. It's surreal. It's insane. Yeah.
Fortunately, the young man was rescued just in time. He spent several weeks recovering in intensive care and later received the psychiatric help and support needs.
Need any help? And if you've got any issues about the job, need a chat or whatever, just speak up. Never hold it back. He did a really good job. It's a big job for any Ambo to turn up to, let alone a rookie for his first job. So it would have been pretty confronting for him.
On his very first job, Rainer has witnessed tragedy up close. It's something he'll need to become very familiar with.
Because of the type of work we do, it puts us at greater risk of being emotionally and psychologically affected by what we do. There's a quote that I really like, and it basically says that the expectation that we can be immersed in suffering and loss daily and not be affected by that is as unrealistic as walking through water and expecting not to get wet.
Jenna, a former vet assistant, has been out of college for 5 weeks.
In the classroom, you taught, you know, this euphoric world, and of course it's not like that when you get out on road. So many things are different, things can go wrong, a patient can go from stable to critical in, you know, a matter of seconds.
It's almost midnight. Jenna and Cleone are called to a suspected epileptic seizure.
I think my wife is having some sort of seizure.
Has she had more than one seizure in a row?
Yes.
Okay. And has the twitching stopped yet?
She just fell out of bed.
So is it just someone having multiple seizures?
Yeah, 50-year-old female, continuous, multiple feeding, conscious and breathing, so I'm still feeding.
The ambulance control centre advises the patient has taken a turn for the worse.
Cardiac arrest. 318, notice it's now 1A. Keep going, keep going.
It's the same job.
Yeah, same job.
The initial call was for an epileptic seizure. Halfway to the job, it updated as a cardiac arrest, which kind of scared me a little bit. I was like, oh no, what are we going to find when we get there?
Hello? Ambulance? Hello? All right, so what's the story?
I don't know.
Okay. Does she have a history of epilepsy?
No.
So you're in bed sleeping and you notice that she's shaking, or?
We were laying up here yakking, all right? She's just sort of like turned over and I went, this is not right, the way she was just laying there. And then I said to her, are you all right? And she wouldn't answer, so I turned, I gave her a good shake.
When you have a fit, you get no oxygen in your brain for a short period of time. So we're giving her oxygen, so hopefully her brain will start to wake up a little. It's a little bit shocked at the moment.
So it's nothing to worry about.
Well, it's something to be concerned about. If she's not known to have fits, it's a concern that she's probably may have had one tonight, okay?
That was shaking.
Is this what she was doing before, sir?
Yes.
Deborah! Deborah! Hello? Deborah! Hello?
Cleone and trainee Jenna are treating Debbie, who is suffering unexplained seizures.
Debbie!
I've never really seen seizures or anything like that before, so it's a little bit different. It's a bit kind of scary for me at the same time. She kept going back in and out of seizures when we were there, but during her whole seizures she was able to open her eyes and look at us. She just couldn't control her arm movements and she just got trembly and very, very shaky.
After half an hour on oxygen, Debbie has improved enough to sit up.
Scary. How's it going?
With intensive care paramedic Graham, Jenna and Cleone need to get Debbie down the steep flight of stairs.
Seriously? Do you think you can make it down the steps?
Because if you get halfway, it's down or...
I'm an undertaker. I know how hard it is to get people downstairs.
Good. All right, well, take my hand.
I'm going to do my darndest.
All right, ready, Jetty? Nice, easy steps, OK? You okay with this? Your legs feel strong? Look at me. We'll be OK.
You need to keep your eyes open.
Okay. Let's go.
It was stressful seeing her like that, not just for me, but, I mean, for the family who doesn't see that kind of thing every day.
You want to grab onto the railing there? First step, you ready?
Debbie manages the stairs, but still has uncontrollable spasms.
Oh, I want to be epilepsy.
Just try to relax, darling. Try and hold your hands together. Grip your arms together. Good.
She's a bit upset, obviously, because it's a bit scary and she doesn't know what's going on. Just a little bit bumpy for a sec. It was a bit odd because it wasn't like a normal, generalised epileptic seizure. It was a bit different, so not what I was expecting.
Doctors couldn't diagnose the cause of Debbie's fits. 6 weeks later, she was still undergoing tests. In Sydney's Campsie, paramedic student Rainer is on 3 days clinical observation. He is about to attend his second ever job.
Stroke so fast. I'll just take a look at my pronouns.
Stroke can cause paralysis, half of the body, can seriously deteriorate someone's quality of life because it's one of those things that can remain permanent. We don't know too much at this stage, so we're going to go up, take a look and find out what the story is.
Hello, how are you? Is it your husband, is it?
Yes.
Yeah.
Thelma called 000, distressed about her 79-year-old husband, Brian. He suffered a stroke 6 months ago.
Everything was all right until Saturday. Bang. This happened. Even worse.
What happened?
Brian has been Thelma's primary carer for the last 10 years. But in recent days, he's had trouble caring for himself.
Well, I just can't walk.
You just can't walk. How did you get to here?
Just hung on to the wall. As you can see, the blood on the wall.
Okay.
Yeah.
Is that from here?
Yeah.
So you've been falling over?
Yeah.
And when did that happen?
I don't know.
So how many falls do you think you've had?
Oh, Lord knows how many.
Coming up, paramedics turn detectives. There's more than meets the eye.
The fridge is empty in there.
Just those 2 sentences have probably created a great difference in their lives.
Push.
Rainer is just 2 hours into his on-road clinical observation. Along with mentor Paul, they try to determine whether 79-year-old Brian has suffered a stroke.
Do you feel weak?
Yes, quite. Very weak. Very weak, yeah.
Stick your tongue out for me. Hi. Okay. All right.
What I'm going to do is I'm going to use this little thing here.
Rainer is asked to perform his first blood sugar test.
Okay, bit of blood's going to come out.
Plenty on the wall.
Rainer and Paul have carefully noted the dried bloodstains in the house and an empty fridge.
The fridge is empty in there. Any breakfast today?
No.
You haven't had breakfast?
No.
Why not?
Just a cup of coffee, that's all.
Why not?
Someone was asleep.
You need a bell to ring and...
Yeah.
Go on, let's go. He seems to be the primary carer for his wife, does all the shopping and the cleaning and cooking. Like they didn't have any food in the house because he couldn't walk around properly.
The classic signs of a stroke are slurred speech, memory loss and paralysis on one side of the body.
You seem to be going off to one side, don't you, buddy?
Yeah.
Is it one leg just feels weaker than the other? If we're dealing with a stroke, you know, it's always better to act fast, they say, get everything sorted out quickly. You know, we'll run him up to hospital and they'll check him out and see how we go from there.
How you doing there? Enjoying the trip? Oh, yeah.
Raina is discovering paramedics can be as much social workers as medical workers.
Your wife will be struggling if you have to go back home too.
Well, she looks after the cat.
Looks after the cat, all right, eh? Forgets about you, Brian.
I suppose it's up to us to report the issues because we're the ones that go into the people's homes, so we're the ones that see, you know, the way they live and whether they need any help. And in this case, they do need a bit of assistance.
After paramedics alerted community services, Thelma now has someone in to help 3 times a week.
So it's important that we look at the bigger picture, tell the hospital what's going on.
Just those 2 sentences will probably created a great difference in their lives.
Yeah.
So just something as simple as that to us can change someone's, I suppose, quality of life.
Yeah.
Doctors determined Brian had suffered a stroke. He was hospitalised for 9 weeks.
I'm proud that I'm one of the people that get called on to help these people. That's what I've always wanted to do. That's why I'm here. So it's just good to come out and get exposed to, you know, what's actually going to happen when we're out here. So, yeah, it's really good to be here.
Next time on Recruits.
So we're in the cross, aren't we?
Cross, yes.
Rebecca's first night in the King's Cross jungle.
I'm fine.
A 2-car pile-up on a wet country road puts Evan to the test.
Oh, my shoulder!
So it's a bloody awful situation we've got here.
And John has to be cruel to be kind.
It's pretty confronting having to cause them pain to help them.
And for more Recruits action, log on to the website.